everybody. I'm Jackie and Benestante from the Autism Society of Texas, and I'm here with Dr. Barry Grossman and Dr. Ruth Aspy from the Ziggurat Group. And tonight they're going to be presenting on demystifying girls and women on the spectrum. We're very excited to have them both. They are experts in this field and very well known and well respected. And so we're really honored to have them talking about this really important topic that we get comments on and questions about quite a lot, about girls and women and diagnosis. And so we're really happy to have them here. And as many of you know, the Autism Society of Texas is a nonprofit organization. And we are providing all kinds of information and referral services, support groups. We do education and advocacy in the community. And we are, we're available. We'll put our information in the comments, but we're always available for help and support. And also in the comments, you'll see we have a Google form for questions for Dr. Grossman and Dr. Aspy. So please, you don't need to put all your personal information in the comments. You can just share it with us on the form and we'll see it. And at the end, I'll read out the questions, as many as we can get through at the end of the presentation. So I'm going to go ahead and turn it over to Dr. Grossman now. He's going to share his screen and begin the presentation. All right, thank you. So yeah, go ahead, Dr. Grossman, and you can also unmute yourself.
All right, I'm not Dr. Grossman, I'm Ruth Aspy, and we are so, Dr. Grossman and I are impressed with the Autism Society, and we enjoy collaborating with the Autism Society and are especially appreciative of this opportunity to collaborate with the Autism Society of Texas. We're glad you're here, and we're talking about a topic that is so important. If we could stand on the street corner and just talk to strangers as they walk by about it, we probably would take the opportunity. And it's demystifying girls and women on the spectrum. The first image that we want to look at, Barry, if you'll go to the next image, is a piece of art by David Bonazzi. And he's an artist that we really appreciate. This particular image grabbed us because when I saw it, I thought that is exactly what it's like to be a girl or a woman on the autism spectrum. The people who are safely swimming in the swimming pool, who have the guards down the side and who have the wall of the swimming pool protecting them and keeping them from the sharks, those are the men. But the woman, she doesn't have that protection. Because she hasn't been identified with autism, she's swimming with the sharks. And we're going to talk about what the risks are of failing to identify girls and women on the spectrum and why this image rings so true to us. So I'm going to hand it over to Barry and he'll take it from here for a little while.
Thank you, Ruth. Let's take a look here at this. We want to talk a little about the ratio of men and women. The CDC estimates a prevalence about 1 in 54 children have autism spectrum disorder. And as we look a little more closely, that's about 1 in 34 boys and 1 in 144 females. And so essentially 1 female to every 4 boys. And this is the ratio we see. And today we're going to be talking about some reasons why we see this difference, why it's not the same, why there's this gap. As we look across the spectrum, we see that that ratio is a little different. So when we look at individuals who have both intellectual disability and autism, that ratio, that gap closes. It's about 2 boys to 1 female. So we have a 2-to-1 ratio. As we look at the what used to be called Asperger's disorder, now would be, of course, autism spectrum disorder, but on that that for those who have who do not have intellectual impairment and who have good language skills, it's about 9-1. And one prominent researcher out of the United Kingdom, we're going to talk about she thinks it's more when we get there, when we're able to identify girls and women better, where we're going to land is back to that 2-1. So we're going to be able to identify individuals across the spectrum. Females are going to be 2-1, and so that gap's going to close. We're not there yet. We're far from there. And one of the questions is, well, why is there this gap? Why do we see this 1 in 4? And research is really helping us to understand that it's not just that it's not just that there's biological differences, but rather the gap is due to a failure to recognize autism in girls. And that's pretty significant. And that's what we're here to talk about today, is some reasons why there's this failure to recognize autism in girls and women, and what are some of the outcomes and what are some of the negative impacts of not having a diagnosis. We see here is a self-reinforcing cycle. So all the research we have is really data from males. As far as you go back, we look at Leo Kanner and even Asperger and the researchers. Largely, those research studies were done on males, not females. And so we have the data from males that is used to really, these are our norms. And then that information, then what happens is we have that kind of creates a template of what autism looks like. Well, fewer females are going to meet that male template. And so fewer females with autism are diagnosed. And the fewer females we have are diagnosed, there are also going to be fewer females that are going to be included in research studies and studies used to help understand what autism looks like. So we have the self-reinforcing cycle. There's the history and research here. Early descriptions, as we mentioned, is really based on boys. And research studies have largely used male-only participants, or we even see roughly 8-1 male to female in brain imaging studies. So our understanding of the brain, our understanding of how autism manifests is very much a boy presentation, a male presentation. And Hape, what she says, this means that what we think we know about autism from research is actually just what we know about male autism. And that's pretty significant. This is Dr. Hape, and we put this little symbol down here in the corner. This is our little symbol we're going to use to point to resources. And we think she is a wonderful, prominent researcher. We like to follow her work. You will find good information, and we encourage you to check out her work and in helping to understand this. Well, let's talk a little bit about the diagnostic criteria here, as she's talking about. Our diagnostic criteria, our diagnostic manual, DSM-5, really describes what autism looks like in boys, in males. And so this is the manual that we all use when we are making the diagnoses, when we're assessing for autism. We're using these criteria. And so we're using the wrong set of criteria, right? This is a male set of criteria. This is what the DSM says with regards to gender. It says in clinic samples here, females tend to be more likely to show accompanying intellectual disability, which suggests that girls without accompanying intellectual disability or language delay may go unrecognized, perhaps because of subtler manifestations of social and communication difficulties. Of course, we would argue that those are not subtler manifestations. It's just what autism looks like in females, and that's what it is. And so our diagnostic manuals are really written for boy autism. Our clinicians, our instruments, everything is tuned to what we know to be male autism, and this is contributing to this gender gap we see.
How dare those girls be so subtle?
Exactly. This is another resource. This is, we wanted to point you to, this is a podcast that Ruth and I had the honor of participating in. And there were 4 women on the spectrum, ranging, they were young, from a young adult to to older adults on the spectrum. And we got to hear about their experiences getting diagnosed and their experiences working in the workplace and so forth. And it was one of the honors of my career to have the opportunity to learn and sit down with these magnificent women for just a little while. And we encourage you to check out this podcast.
Barry, why don't you tell them about the little blue symbol down there?
Right, that's our resource symbol again, and so we put down the website there for you, and so we encourage you to check that out. So let's talk about some gender differences in identification. This might get your blood boiling. This is my little spoiler alert. Research is showing that girls are less likely to be identified with autism, even when their symptoms are equally as severe. So again, you have two individuals going into the doctor's office. One of them is going to come out with a diagnosis and the other won't, even though their symptoms were equally as it was impacting them equally. When clinicians review records and we look at the symptoms that have been documented, again, the boys are going to come out with a diagnosis, not the female. What we're finding is that for girls, sometimes what we see is that they don't get recognized, they don't get identified until you kind of have this autism plus situation. And what is the plus? It means that not only do they have to have the signs and symptoms of autism, but they have to have behavior concerns. And I'm going to say that in air quotes. So it's not until they're really struggling, or maybe their mental health has to decline. So they have develop an eating disorder, severe depression, or severe anxiety. And then and only then do people finally see that maybe autism is there. And so we have this autism plus is what it takes to kind of push over that threshold to where someone will finally identify the female with autism spectrum disorder. And I will tell you, in practice, sometimes what we see is a little different. We see that sometimes that plus it overshadows the autism and actually prevents diagnosis. Let me show you an image to show you what we're talking about here. In this situation, you see social anxiety disorder, and underneath that is autism. And so you have characteristics of another disorder like social anxiety disorder. They're evident, and they're mistakenly used to explain the complete diagnostic picture, but it's not the whole picture. And so this is what diagnostic overshadowing is, when in fact you might have, in this case, two conditions. We call that comorbidity. So you could have social anxiety disorder and autism spectrum disorder. In fact, this is one of the most common presentations that we see in women. I was talking to Ruth earlier about this today, and I said social anxiety disorder is kind of this very natural offshoot for autism. And so here you have girls and women who are already have some delays in their social communication skills, and they have the insight and awareness, and we're going to talk indeed about a little bit of that a little bit later today. They have the insight and awareness to know that they're not quite fitting in, and they're really struggling to fit in, and they go through great efforts to try to fit in, and then that morphs into anxiety, in this case, social anxiety disorder. And so from a clinical perspective, you're not only having to help to address those, those underlying social communication delays, but then you're also having to teach skills for addressing that underlying social anxiety disorder. And so we see these two co-occur quite frequently.
All right. We're going to talk about the difference in the age that girls and women tend to be when they're diagnosed compared to boys and men. And I use this photograph. It's a photograph taken by a friend of mine, and I just think it's beautiful. But one of the reasons I like it here is because one of the little girls looks so perturbed. And that's how I feel when I think about the delay that girls and women go through in the process of being identified with autism. So on the next slide, you'll see that the delay between the time that autism is first suspected, when the concerns are first apparent, and diagnosis in females tends to be 2 years or longer, and that it takes longer for girls to be identified than for boys. And that goes all the way through, that goes across the spectrum, and it goes all the way through um, the uh, the lifespan, so that even in adulthood, um, adult males who are identified are younger than adult women who are identified. As a matter of fact, we've encountered on number of occasions, more than I can count, I think, um, that women who will tell us that the first time that anyone suspected that they might have autism was when their son was diagnosed. So when autism was recognized in their child, in their son, it's always a son, or it has been in the situations that have been reported to us. Then the clinician will look at the mother and go, oh, you know what? I think I recognize these characteristics in you. And it took there being a male in their life related to them for someone then to be able to decipher that in the person who has already been experiencing their characteristics of autism for decades. And the next slide talks about that experience, that delay comes with consequences. That people who have a late diagnosis are more likely to experience these things, more likely to experience rejection from peers, to be isolated socially, to struggle more academically. And they're more at risk for mental health challenges and for behavioral disorders, such as anxiety, depression, eating disorders, OCD. We'll talk about others. And additionally, next, they are depression and anxiety. This is a recent study. And next, suicide. And this is a study from 2019, where they looked at a certain region, and they looked across the years 2013 to 2017 at the suicide rate in a population. And what they found was that the rate of suicide was much higher among people with autism than it was with people in the neurotypical. People without autism, we tend to use the word neurotypical. And so the people who were in the neurotypical population had a much lower rate of suicide than people with autism. But when they looked more closely at the data, what they saw was almost all of the difference between those with autism and those without autism in the area of suicide, in the rate of suicide, was accounted for by females. So that females with autism had over a 3 times higher risk of suicide than females without autism. Then, if you go to the next slide, we also see a lot of information about the rate of anorexia and autism. And there are some studies that have said as many as 23% of women hospitalized for anorexia meet the criteria for autism. Another one, 35% of women who got services because of anorexia also had autism. And one of our colleagues, and you saw her standing in the image of the podcast that Dr. Grossman talked about. One of the person who was standing there is Kim Clary. And Kim is both an occupational therapist and a woman with autism. And she first was diagnosed with anorexia. As a matter of fact, she almost did not survive her experience with anorexia, and she had gone through years of other diagnoses before someone recognized the autism. And she tells us to be a little bit cautious with these numbers. So, Perry, if you'll go to the next slide. She says that actually, when women have, when people experience malnutrition, that when it gets severe, that they may actually show some signs of autism. That once they're well nourished, those traits will diminish. So that's not actually autism; it's actually an effect of the malnutrition. So she recommends that we be a little cautious with these numbers. She thinks that the numbers may be somewhat inflated, but then she says, and this is a quote from Kimberly Clary, she says, it's important to be aware of the relationship between autism and eating disorders, because when the two disorders co-occur, the recovery rate is low and the mortality rate is higher. These clients tend to have the worst outcomes. So that becomes an important reason to identify them. So the relationship between autism and anorexia is not to be taken lightly, and it increases the risk for mortality in this group. And what Dr. Grossman and I would say is that when autism co-occurs with any other condition, it will take a different approach to intervention. And if you have a child, or you are an individual on the spectrum, and you are dealing with autism and anxiety, or autism and any depression plus anything else, we encourage you to seek someone who knows not just the mental health aspect of depression or that particular condition, but also is familiar with working with people on the spectrum, because it takes a combination of those skills to be able to be helpful. If you can't see the underlying autism and you don't address the characteristics of autism, it's very difficult to be effective with the other conditions that are present. Go ahead.
Just going to add as well, with regards to assessment as well, we want to find someone who's evaluating who really knows autism in females. And this is a perfect example, because differentiating, how would one go about differentiating? And you'd want to know, what did this individual look like before the eating disorder, manifest? And so through careful history taking and understanding what you're looking for, you can determine whether it's one or the other or both. And so, because that would be very important, as Kim Clary points out, when it is both, you would obviously it's important to know you might need to take additional precautions and put forth even a more intense effort in addressing those needs.
That's exactly right. You need both. You need someone who understands autism in girls and women, and you need someone who understands autism and another condition if they're present. So it sometimes it's challenging to find that group of people. But the next slide just talks about this. The repercussions of failing to recognize girls and women with autism. At the individual level, without identification, a girl continues her course of development without critical interventions and becomes increasingly at risk for depression, anxiety, and victimization. And we haven't talked about that, but indeed, girls and women on the spectrum are at higher risk of certain types of crime. At the system level, the failure to identify girls perpetuates this failure for future generations. So if you're listening to our voice, we are wanting to recruit you as people who know that it's time to do things differently. It's time to think about this differently, and to change the approach, and to begin to look more clearly at what autism looks like in girls and women, and not fail to recognize them in a timely manner. So the next slide is when Barry and I, Dr. Grossman and I, went on a rant with each other, and we were talking about how frustrated we were with the lack of identification for girls and women. So this is a little bit tongue in cheek, so forgive us. But here's what we did. We came up with a flow chart. We said, does the person have the characteristics of autism? No, then no diagnosis. Does the girl or woman have the characteristics of autism? Yes. Well, she's a girl, so no referral, so no diagnosis. Another possibility is yes, but she's a girl, so she doesn't meet the cutoffs, and we'll talk about that. But the instruments are designed so the cutoffs aren't normed for girls or women, they're normed for males. Or it could be, does she have the characteristics of autism? Yes, and she meets the cutoff, but she's a girl, so we're going to assign a different comorbid condition. We're going to ignore the autism and assign some other diagnosis. So almost any way it goes with girls and women, it seems like the system is designed for them to end up without the autism being recognized.
We see this all the time when we evaluate, when we're looking at reports. Oftentimes women will come to us for counseling and they've been evaluated before and they weren't identified. And we look at those reports and they'll say things that sadly show the need for more training. Things like, she's too social, she looked at me in the eye, she carried on a conversation, she can't have autism, is how all those sentences end. And it really helps us to understand that there is a huge gap right now in the knowledge base of the professionals that are out there doing these evaluations. And so that is one of the reasons, as we've talked about, one of the reasons why we have this huge gap between men and women and boys and girls, is because we're failing to identify. We don't know what we're looking for. We're looking for boy autism. We're failing to identify. We are dismissing the characteristics when they're there. We are seeing, the measures show equally high levels, but the boy walks out with the diagnosis and the girl doesn't. Or we're seeing other things and we're saying, well, she's just anxious. She's just being a girl, right? Or we're dismissing it because we're doing diagnostic overshadowing. Lots and lots of reasons, lots of concerns. And so the end result is the same: no diagnosis, and we know that means no appropriate services, and can be some pretty negative outcomes.
So sometimes, on the next slide, a girl will get a series of mental health diagnoses before eventually they get the autism diagnosis. And we're going to look at a specific individual who's Greta Thunberg, and I imagine that many of you are familiar with her. So Barry, if you'll go on to the next slide, we're going to show you some excerpts from things that have been published. This is from CBS News, and it's a headline. It says, Greta Thunberg's dad says he was not supportive of her activism, but then he saw it help her out of depression. And I guess I'm making an assumption here. Greta Thunberg is a young woman who has been diagnosed with autism, and she is very well known, is world renowned for her work in addressing climate change. So the dad talks about that is here referring to her depression. So on the next slide, you will see more from the father, and it says that he says that she struggled with depression for 3 or 4 years before her first school strike for climate change. And this is a quote: "She stopped talking, she stopped eating, she stopped going to school. It was the ultimate nightmare for a parent." And he says, eventually, the family went to the doctors for help, and Greta was diagnosed for Asperger's on the autism spectrum. And one thing to note here is that in Europe, they use a different diagnostic system than we use in the United States, and that is why you see Asperger's there, because that is still used there, but it's what we would call autism here, part of the autism spectrum. But the important thing on this slide is she struggled for 3 or 4 years before and look at how severe it is. She stopped eating, she stopped going to school before her autism was recognized. So on the next slide, you see additional information about Greta. And this is Greta herself. And she says, "I stopped talking, I stopped eating. In 2 months, I lost about 10 kilos of weight. Later on, I was diagnosed with Asperger's syndrome, OCD, and selective mutism. That basically means I only speak when I think it's necessary. Now is one of those moments." So you see here that we've highlighted the words "later on," because look at all that she had to go through before someone identified the autism. On the next slide, you'll see more quotes from her. And she says, and I'll just quote this one part that's highlighted. This was a response to her learning about starving polar bears and seeing in school videos about that. And she became devastated by it. And she says, "I almost starved to death." In the next slide, you'll see her. This is from her social media, and this is what she actually posted. It says, "When haters go after your looks and differences, it means they have nowhere left to go, and then you know you're winning. I have Asperger's syndrome, and that means I'm sometimes a bit different from the norm. And given the right circumstances, being different is a superpower." So she says here that being different, having autism for her is a superpower. And she goes on, "Before I started, I believe my diagnosis has limited me before. Before I started school striking, I had no energy, no friends, and I didn't speak to anyone. I just sat alone at home with an eating disorder." So you can see the superpower side of her experience, and you can see the challenging side of her experience. The next slide is a response of a journalist who also has autism, a woman with autism. And she says, "Don't call Greta Thunberg superhuman. We don't need pernicious code words about autism to praise a remarkable 16-year-old girl." And here's what this woman, Sarah, says. She says, "I am also autistic. At first, this kind of praise was heartwarming. My autism presents in similar ways to Thunberg's. Many of the things people laud her about her tenacity, that she marches to the beat of her own drum, her seriousness, are things I and many of my autistic peers have been mocked for." So her fear, I think, that she's describing is that people will look at this person, Greta Thunberg, who has had such success, and will maybe dismiss the challenges that she's faced because of her autism. And what Dr. Grossman and I would suspect is that if her autism had been addressed early on, she would not have had to go through some of the other challenges that she has faced, or she would have certainly had more supports in dealing with these things. So we have a question, a couple questions, and one of them is going to be a poll for you. So the first question on the next slide this is Greta on the cover of Time, the Person of the Year. And the question I have for you is, are the odds greater that a young girl with autism will be the next Person of the Year? And the odds for that are 1 out of 7.5 billion, or that she will struggle with bullying, loneliness, eating disorders, depression, or abuse. So what is the likely outcome that an individual with autism will end up being a celebrated superhero? And the next slide is your poll question. And so if you will, you should have access to that. I'm not sure exactly.
Yep. Oh, hey, I'll dump in.
Okay.
Dr. Aspy, thank you. So yeah, so if everybody will just in the Facebook comments, we've got poll number 1 posted, and it's probably what you're seeing on your screen. Hopefully there's not too much of a delay, but it's, would specialized instruction change the trajectory for some of these girls? And it's just one question. So if you click on it in our Facebook comments, you should be able to answer it. And then we're going to discuss how everyone's voted in a second here.
Perfect. And while you answer that, I'll just say, so for some of you, you know exactly what we're talking about when we say specialized instruction. And the reason we use that is that's the term that's used in the public schools in the United States when we ask ourselves, might this person benefit from services at school? Might they benefit from some form of therapy at school or extra support at school? That's what specialized instruction, that's the term we use for it. And so do you think that someone as smart as Greta is might still have benefited from some supports when she was younger to address some of her characteristics of autism? That's what this question is about.
Great. Yep. So everybody, just as a reminder, if you're watching, we've got quite a lot of people watching, which is excellent because this is some really good information. So this is Jackie from Autism Society. Take a minute and just answer the poll. It's posted in the comments, and it says poll number 1 in the comments. And it's just a quick 1-question Google form. It's this question that's up on the screen now. So go ahead and take a minute to answer. And then we will discuss the results. Should sing the Jeopardy song. Don't tempt me. No. Yep. So very good information, by the way. Thank you very much. I know everybody's got to be enjoying this. We've got quite a lot of viewers, and we're getting quite a few responses here.
Good.
So this is super helpful because we see everything you're talking about. We see in our information and referrals calls. So this is going to be very helpful information for families.
That's great to hear.
Yes, really confirms what we're seeing, in research, and not just anecdotal. It's yeah, really helpful. All right, let's see. Well, it's been a couple of minutes. Should we give everyone 1 more minute, or do y'all want to hear? We've got 27 responses right now, which is pretty good. If anybody else wants to answer the poll, do it now. Last call. And then we'll continue on with our discussion. All right. About 5 seconds. Okay. I'm going to go ahead and read this. So it says, so we've got our answers, and it says, would specialized instruction change the trajectory for some of these girls? 96.3% said yes, and only 3.7% said no.
All right. All right. I bet you all know what our bias is, don't you? that we kind of lean with the yes on that. And, and maybe some of the no's are thinking, well, that's not where the support should come from. And that's okay too. There's room to think about it, to think about this differently. On the next slide, there's an image of the challenge that, there we go. The way that we see the challenge. And this is another one of David Bonazzi's images. And at the top, we picture this as getting identified with autism. And you see on the left-hand side, the men are easily riding up the escalator to their diagnosis or their eligibility. And you see on the right-hand side, the women having to struggle their way to the same place. And we think that's just a good depiction of the struggle that women and girls right now are having in this area. All right, Barry?
I wanted to make a comment on I think the 37%. I wonder, I'm guessing that some of that 37% back on this poll, we're thinking that instruction might not change, and perhaps that 37% was
Barry, I
feeling.
don't think it was 37. I think it was.
Yeah, it was 3.6. It was 96.4% said
3.6.
only 3.6% said no. And
Okay.
then in the Facebook comments, which I didn't read, but a lot of people said yes, absolutely, instruction would have helped. And a lot of comments that said yes, even though they didn't comment in the
I'm so glad to hear that. Okay, because I heard that number wrong. But I did want to add something, that because sometimes people will ask us, they'll say, especially maybe late back before COVID, when we were flying on airplanes, and someone would ask what we did for a living. Oftentimes we get that question, oh, autism, do we know what to do about that thing yet? Do we know what to do about it? And the answer is yes, we absolutely know what kinds of interventions and supports can be beneficial and really can change the trajectory for individuals on the spectrum. But the problem is, some of those individuals aren't getting the services, right? And like in this case, not till years later. And in others, the other issue is not everyone is knowledgeable about what kinds of services and supports people are getting. So we want to get the services as soon as we can to the people who need it, and especially women who are getting diagnosed later, or if they're diagnosed at all. So just wanted to add that little piece there too. So let's talk about some reasons for under-identification. One of them, as we talked about earlier here, and want to add to this, is referral bias, right? And so girls with autism are showing, notice it says different and less severe, different than who and less severe than whom. It's different and less severe than boys. And so their communication challenges are different, but that doesn't mean that they don't have challenges, and that doesn't mean that they don't have autism. It means it's what autism looks like in girls. Families and professionals are often attributing those challenges to shyness or anxiety, and so we have fewer referrals. Another reason why we see under-identification, this is showing actual brain differences, and the little red dots there are showing how the areas of the brain where girls differ from boys. And just to boil it down here, there are real differences in the brain. So from that level, and so brains are looking different, and so of course, girls are going to act and function different than boys. But that doesn't mean they have autism. But the problem is we're still using that boy autism template. And so we shouldn't be using this boy autism template. We should be using, our autism template needs to change, and it needs to include all individuals with autism, not just boys. Another reason why we see under-identification is there really are, as we've highlighted here, there really are some gender differences. Sometimes we see fewer special interests. Their social skills, their superficial social skills appear better. And so, and we'll talk about that in a little more depth, but oftentimes girls are in first encountering them, or maybe through short interactions, we might walk away thinking that was just a wonderful conversation I had with her, and or what a delightful child. And we don't realize how hard that individual may be working to maintain that conversation, to keep that conversation kind of looking or appearing the way that it did. We see better language, better communication skills, again, than boys. And we see less hyperactivity, less aggression. So these individuals they're not standing out as much, right? These individuals are seemingly more successful in social settings. They're not exhibiting significant behavior problems or disruptive problems. And so they're not getting referred. They're not getting evaluated, or when they are, they don't appear to fit that template. we see a lower level of restricted interests. And again, this is one of the kind of the core features in autism is so oftentimes we see narrow interests and repetitive behaviors. We call them our RBs, restricted repetitive behaviors. And so research is showing us that on assessment, on measures of these interests, that females really do have lower levels of these interests, and that it's not just due to measurement bias. And so what the belief is that, again, because clinicians are looking for those restricted interests, it's one of the core features that we're using to identify autism. When those restricted interests don't stand out, when there's a lower level of them, that they may not be identified. And so we say less prominent restrictive interest equals misclassified. And so this is the quote here from the research, says that they may miss being tested for autism, or they may get misclassified as having social communication disorder. And so that is something else that we're going to talk about here. Brings us to our second poll.
Yes. So this is Jackie again. So we are going to go ahead and post that. So my behind the scenes folks on Facebook, which are Leslie and Kate. Do you guys have the second poll posted? I can't see yet. Let's see. Let me make sure. I'm not seeing it. Let's see.
In our poll, actually, I realized we have a mistyped word. It should say social communication disorder, not social pragmatics disorder. Sometimes social pragmatics is a word for our social language, our social communication. And so the actual disorder is called social communication disorder. Have you encountered anyone diagnosed with social communication disorder?
Great. And we just posted the poll. So look for poll number 2 in the comments. So yeah, and so as Dr. Grossman mentioned, it's have you encountered anyone diagnosed with social communication disorder? And that's poll number 2 in the comments. So go ahead and take a minute now and just go ahead and answer that. And it's social communication disorder, which is good to know, because I was like, gosh, I haven't heard of anyone with social pragmatics disorder when I saw this earlier, but I have heard of social communication disorder. So
I've heard of a psychologist who typed it wrong on a slide once.
Actually, several times, as you see the next several slides. But the reason we did is because in the discussion of it, professionals go back and forth between these two terms, between social pragmatic disorder and social communication disorder. So you'll hear it referred to either way, but the official title in the DSM is social communication.
Okay, that makes sense. Thank you for explaining it. I didn't know that that was referred to the same thing. Okay, also, if you're watching, which I know we still got a lot of people viewing, we've got poll number 2 posted in our Facebook comments. As we were just discussing, the question is, have you encountered anyone diagnosed with social communication disorder? And that's poll number 2. So we're going to give everyone a minute to go ahead and type. Oh, and we're getting some responses. Thanks you guys for voting. All right, we'll give everyone another minute or so. Let's see. This is our last poll of the evening. I wish we had prizes to give out, but we don't. I was going to see if anybody's commenting while we're waiting. Okay, we also got a yes and a no in a Facebook comment, so I guess they cancel each other out.
Okay.
All right. Well, I will go ahead. We've got 24 responses now. So I'll go ahead and go with that one. So,
Okay.
So it's okay, or I'll give everyone last call. Vote now if you're voting, people. So poll number 2, the question is, have you encountered anyone diagnosed with social communication disorder? And our responses are, we got 24 responses. We got 70.8% said no, and 28% said yes.
Interesting.
Might actually be a good thing. We'll see why. So here's a little bit of the background here, is that in our diagnostic manual, again, this is the one we're using here in the States, there's autism spectrum disorder, and there's another disorder in there. I'm going to say it's a new disorder. It's new to the DSM-5, which we were talking about, was it 2013, I believe. Is that right? 2013 is the
Yes,
copy on
that's
that
right.
one. And social communication disorder. So social communication disorder was brand new to this edition of our diagnostic manual. And one of the I think one of the leads on the DSM-5 team was Dr. Catherine Lord, and we encourage you. We put our little symbol down here, a resource. We encourage you to listen to this discussion. We think that there's some very valuable information here, and the way our diagnostic manual has worked, diagnoses have worked in the past. About every 10 years or so, the manual is revised. And usually there's good reasons for changes in the manual. They do lots of research, and they have committees that meet together and discuss what changes need to be made. But they did something kind of special in this one, and special isn't always good here. And in this case, they created this social communication disorder. And so I want to read you direct quotes from their conversation. Dr. Tager Flusberg said, "There really isn't much evidence at all that social communication disorder does in fact exist as a standalone disorder. It's not clear that it is a valid syndrome. Having introduced it opened up a new Pandora's box, just when we had closed the one that had been opened with PDD-NOS and Asperger syndrome." And Dr. Lord said the DSM-5 process was one where we went back and forth between empirical evidence and essentially political and health decisions. People were very concerned people would get left out with a diagnosis. Empirical evidence is not in support of social pragmatics. Social communication disorder. We use these terms interchangeably, but it's the pragmatic language, the social communication disorder. And so, unlike other conditions in the diagnostic manual, this was not based on empirical evidence. It was not research studies. They essentially looked at health decisions. They were concerned about some people being left out from if they couldn't get a diagnosis. And there were some political things in place as well. So this was a very different process. And so sometimes we will see individuals who actually have autism spectrum disorder. Again, it's a partial diagnosis, we would say here. They're being diagnosed with social communication disorder instead. And more often than not, the reason why they're diagnosed with social communication disorder is because the evaluator didn't ask the right questions, because the evaluator maybe wasn't as familiar with what autism looked like in girls and women. And so this is where this comes from. And so it's a concern of ours as well. We want to get the right identification so we can get the right services as early on as possible. Let's talk a little bit more about these special interests. We mentioned that there can be some differences between girls and boys, but they're both on the spectrum, right? And what ways are special interests different? And this is a great quote from Francesca Happe. "A girl with autism may be fascinated by horses or by a particular pop star. This isn't unusual among girls and may not stand out as much as a boy who is obsessed with the Latin names of plants, for example. But the intensity and the narrowness of her interest is unusual." So what is she saying here? She's saying that for females, their narrow interest may not stick out so much. They may not be so unusual. We know boys, for example, who are obsessed with, World War II, and they can name the model of the tank that was, in a specific battle in 1942. Or they can name, maybe the model number of the air conditioning unit that's in the Empire State Building or something. And it kind of stands out. You remember those things. But for girls on the spectrum, their interest might be less remarkable. Maybe they're interested in pop stars, but they're still intense and they're still narrow. And that might be the area they know a lot about it. That's what they like to talk about a lot. But it may not be as unusual. And here's some other examples of some circumscribed interests, things like animals or dolls or pop groups or literature. We've known girls that love reading about counseling mental health, self-help. And we've had lengthy discussions about, who's your favorite, psychologist or author. Um, a little different there. Imaginary friends, fantasy kingdoms, princesses, and social media. And we might think, oh, social media is very popular, in teenagers and other maybe young adults, and maybe even especially women. But again, it's the intensity. They might be sending out 5,000 text messages or posts in a day. They may be checking their social media more often, and becoming more kind of engulfed in that social media world than would be typical.
So let's talk about some of the challenges that we have with the instruments used to look at autism. And the next slide shows an image that we use to kind of talk about this. You see a physician standing here, or some professional standing here saying, so the test came back negative, you're free to go. And it seems apparent that she's distressed by the idea that the person can't see that things are not okay with her. And that's what we see sometimes with people with women and girls on the spectrum, is that they know something's not okay and they know that they're struggling with some things, but the tests, the instruments that are used aren't catching their characteristics. So people are telling them, yeah, you're good, you're free to go. So let's look at the next slide. Some of the challenges with instruments is there's some gender bias because they're based on descriptions of autism in males. In particular, the repetitive behavior scale revised. The items that are included on there are biased towards the kinds of special interests that Dr. Grossman described that are more likely to be true of boys and men than of girls and women on the spectrum. So it's not as likely to catch the girls and women. On the next slide, you see other concerns. The standardization samples for most instruments in the area of autism were based on boys. And so the cutoff scores are based on norms that are from boys and men that when the research was done on the instrument. So the norms don't apply well to girls and women. So people who are using the instruments need to be more flexible with a cutoff score. The cutoffs are good for describing how the I can't curve looks in boys and men, but not how it looks for girls and women. So there are many people in the field of autism who specialize in working in girls and women who encourage other professionals not to use cutoffs in a rigid way because they don't apply well. There are very few instruments that have cutoffs that are specific to females. So the next slide, we're going to look at a video of a young woman talking about her own frustration with getting the diagnosis.
When I was younger, I would mimic my favorite cartoon characters, their way of walking, the words they used, and how they spoke to one another. I absorbed this information and then applied it to my social interactions, almost like copying and pasting. But I quickly learned that life is not a cartoon. People are not characters who behave predictably. And imitation can only take an Asperger girl so far. By the time they reach adolescence, trust me, they are mentally exhausted and emotionally wrecked. Social relationships become so much more complicated. And for an Asperger girl, every conversation becomes like a math problem. And I remind you here that we are not all quirky genius types. I managed to mask my Asperger's for 14 years. And then I crashed. The loving people in my life rushed in to help. And one day I found myself sitting in a room with 2 occupational psychologists, a bag of feathers, thumbtacks, and a book about flying frogs. This, apparently, was the ADOS test, the standardized test used to identify autism, the same test that my brother took 7 years previously. They set me some simple tasks, and they asked me questions about my life, my family, my interests. I responded to these in the only way that I knew how, by copying and pasting the correct answer. So I smiled. I shook hands. I gave eye contact as I knew I was supposed to. I'm not sure what the story with the flying frogs was meant to tell anyone about me, but apparently it told them that I wasn't on the autistic spectrum. In fact, I scored a 0. I failed. I really didn't have autism. But it wasn't me who had failed the test. It was the test that had failed me.
All right, so we have to be careful about the instruments that are used and making sure that people are able to be flexible with those instruments when they are assessing girls and women. And also there's something that she said there. She said, I copied and pasted. So what does that mean? It's a reference to the next slide, which is something that's called masking, blending, acting, pretending, mimicking, or camouflaging. We tend to call it camouflaging. What is camouflaging? Next slide. It is strategies used by autistic people to minimize the visibility of their autism during social situations. Conscious or unconscious techniques that result in a less autistic behavioral presentation. And why do people camouflage? Because they want to fit in. They want to look non-autistic in order to be able to have relationships with other people. So next. What are some examples of camouflage? Forcing oneself to make eye contact during a social interaction, pretending to make eye contact by looking at the space between someone's eyes or at the tip of their nose, using working memory strategies to develop a list of appropriate topics. Let's hear Kim Clary talk about her description of camouflage. This is the young woman, the occupational therapist that we've talked about. And here we should have put a little symbol here. This is shows her where you can learn more about her work. And she says here, when I was a child, I became a very good detective. I watched people and I analyzed everything, still do. I learned healthy and unhealthy coping strategies to handle the sensory world. I became an actress living in the movie of life. I mean, what a good way to describe camouflaging, acting. She studied her world, and we see girls do this all the time, studied, analyzed, really focused on other girls. And a lot of girls will find someone in their world who, or women will find someone in their world who's particularly socially successful. And they will tune into them, and they will look at what they say, look at what they look at how they move, look at what their facial expressions are, and they will take on those characteristics as part of their camouflaging. We're going to watch a video of a young woman who's describing her own camouflaging experiences.
Something that everybody does to an extent. So, for example, You know, we all have a little bit of a vocabulary in our heads, you know, how are you? How's your day been? How's the weather? Blah, blah, blah. But for autistic people and for someone like myself, I have developed a coping mechanism called scripting. And this is part of my masking trait. So scripting is basically where I have, you know, just grown this huge vocabulary over the years of phrases and quotes that I've learned, taken from other people, films, the internet, anything really that I can find that, you know, I can find that is socially acceptable, and I have applied it to myself. I rely on scripting to the point where without it, I don't know what to do. Once I've run out of stuff to say, I'm very awkward, and I kind of can't function as a neurotypical, and so I will appear rude or ignorant or something like that. But really, my script has run out. I can no longer mask. I can no longer hide my autism, and so I'm basically done with this situation. So for me, masking is really hiding my true identity with the use of using a version of myself that has been taken from lots of places, lots of other people, all rolled into one, and that is my socially acceptable version of my identity. So what are the negative impacts of masking? For me personally, and this affects a lot of people out there, which is why a lot of females in particular get diagnosed much later on in life, and it's because we are so good at masking that not even health professionals can identify this sometimes in us. And this is my personal story about how this affected me. So a couple of years prior to me being diagnosed officially, I actually went to my doctor, and this was after, you know, well over a decade of a battle with mental health services, lots of therapies. You know, I've had dialectical behavioral therapy, cognitive behavioral therapy, one-to-one with psychologists, nothing worked. So I felt like I had exhausted every other avenue to do with my mental health and the way I was feeling. So I came to the conclusion that something is bothering me, something deep down is affecting me, my everyday life. And I raised the question with my doctor, and I said, could I be autistic? Now, here's where the complication of masking comes into the story. Now, he looked at me and he said to me, well, you can't be autistic because you're looking at me when you're talking to me, and autistic people don't do that. Now, had this doctor been educated on autism and the effects of masking in females, which should be identified widely as an autistic trait, especially in females, then he would have known that because females are generally more socially aware, we are much better at maintaining eye contact. And this is through masking. So although masking may be an autism trait in itself, as well as a coping mechanism, diagnosis isn't the only negative aspect of masking. Another negative aspect is how it affects your mental health. So for example, when I was 19, it's a very, very dark part of my life, which I will go into another day. However, my mental health really hit rock bottom, and this was because through years of masking and mimicking other people and pretending and acting to be the socially acceptable version of myself, I actually lost my sense of self, and I lost what my true identity was, and I had a major identity crisis, and I kept going back and forth with the doctor, telling them the same thing over and over, and that was, I really don't know who I am. I don't recognize myself. And although it sounds really cliche in the mirror, I couldn't recognize myself in the mirror. You know, I was totally, totally lost within myself. And I think this is also kind of similar to method acting, where, you know.
All right. That's a good place to stop. She does such a beautiful job, of course, of describing it because she's been there. And one of the important things to recognize about camouflaging or masking is that if you had 100 women on the spectrum and 100 men on the spectrum, and you ask them, do you use masking? Do you use camouflaging? The same percentage of males would report yes as females would report yes. So it's not that more women with autism mask, but it's that women with autism mask more. So they mask across more situations, more frequently, more of the time. So they're more likely to have spent so much of their time pretending to be someone they're not, trying to fit into the world, desperately trying to fit in, that they lose themselves, that they lead to other, that this leads to other conditions. So on the next slide, you'll see some of the, keep going. There we go. Some of the conditions, depression, they're less likely to get clinical support because people aren't recognizing the autism that they need support with. They're less likely to be identified with autism, and they're more likely to be at risk for suicide. So the fact that women mask more leads to some of these challenges. It also leads to, on the next slide, exhaustion, sensory overload, and loss of skills such as speech and executive functioning. So we have, Dr. Grossman and I have on many occasions worked with girls and women who have a lot of skills, who have a lot of ability. They may hold a job or they may be doing well at school, but they will hit a point where they actually lose their ability to communicate using speech. And we kind of heard that with Greta Thunberg, that they may go through the day and look like they're doing okay, and then they'll hit a point where they're not able to ask for help, or they're not able to say their name. And it's the same person. It's just that the stress of pretending, of covering autism, it can just eventually breaks down. And sometimes you'll see someone who's able to hold it together to look as typical as possible for hours at a time. And then as soon as they get alone, they will begin to rock, or begin to jump, or begin to make grunting sounds. And if people haven't seen that, they would not believe that someone who presents like the woman we just saw in that video might also spend time shut down and or engaged in repetitive movement, that type of thing. But we see it, and we know it's true, and it's an effect of camouflage. So on the next slide, the point is made that that the reason that people camouflage is because they have enough insight to perceive that they are negatively perceived by others, and they have a strong motivation to adapt their social behavior in order to be accepted. And so people with autism can have enough insight to understand that they're being rejected. And you know what? They really are being rejected. And on the next slide, we see that there is research to support that neurotypical people without autism, do tend to be reluctant to interact with their autistic peers, and they shun them. So it isn't in the imagination of people with autism that they are being rejected because of some of their differences related to autism. That is indeed true. And there was recent research, Barry, if you go to the next slide, that shows that this was actually just weeks ago that this was published, and they showed video of training people about autism. And they found that when they showed this to non-autistic people, that they were actually able to change their attitude towards autism, have more positive beliefs about autism. Yet they still connected unpleasant traits with autism even after they watched the video. So there's some effect that we could have just by training people, by helping people be more familiar with autism and the characteristics of autism. But the next slide, you see that there's something called the double empathy or dual empathy problem. And that's the idea that we tend to think that people with autism need to have more empathy. But what we realize is, you know what? Neurotypical people, people without autism, need to have more empathy for people who have autism. And the more people with who are neurotypical accept people with autism, the less people with autism are going to need to camouflage. And the more they're going to be able to belong, have feelings of belonging without camouflaging. And that's going to make a difference. It's especially going to make a difference for women. And we need to recognize that everyone has a role in addressing this challenge. So I want to just quickly show you, and then we'll have time for questions, show you an instrument that is called the Camouflaging Autistic Traits Questionnaire, the CATQ. And again, this was developed in the UK, where so much great work is happening. It is something that you can have access to, and you can suggest that people utilize. And Dr. Grossman, if you'll go down to the slide that just shows the link to it. There you go. You can actually go online and I have this link in your handout, and it describes a range of characteristics that people who camouflage show, and it helps to measure camouflage, and it makes a difference. It especially makes a difference if you're working with a girl or a woman on the spectrum, to be able to look at how they're camouflaging and how that's impacting their mental health and their functioning in the world. And all of us, I'll tell you this, all of us camouflage some. If we didn't camouflage some, you know, I would probably have on my nightgown right now while I'm doing this, you know, how we are in the Zoom world. Or we would probably, you know, be less pleasant to each other from time to time. So we all camouflage, and it's not always bad. It's not always a problem, but it is a problem when we hide our real self so much that that we lose ourselves, and that we feel like we would be rejected if we didn't hide our real characteristics. So we have kind of flown through this information about camouflage, but it's important for you to have. And what we want to do is be able to have time to take some questions if you've got them.
Okay. Hi, y'all. Thank you, Dr. Grossman and Dr. Aspy. This was so helpful. And we do have quite a few questions. We've had we do have a lot of questions. We've had quite a few people watching. So we really appreciated everybody. And I'll go ahead and try to read off some of the questions. There's a few because, yeah, we've got a few overlapping questions.
Okay.
And so I'll kind of condense those. But one that is being asked, 2 or 3 people have asked this, and it's about specialized instruction. First, a lot of them around education based, but it says, what is the recommended specialized instruction? And then there was also a question about, just mentioning, it's more of a comment, schools that are often not equipped to deal with the emotional regulations and social skills development. And then of girls, and particularly for students in general ed with normal or above normal intelligence. And then, yeah, so specialized instruction. And I thought I saw another education question, but yeah, if you guys have recommendations on specialized instruction, what would change the trajectory? What's recommended is basically what a couple of people have asked here.
I'll start here. As far as schools being equipped, you know what? How well equipped schools are at addressing the needs of students with autism, especially students with strong cognitive skills and autism, it varies so widely. And there are spots across the United States where beautiful work is being done with kids with strong cognitive skills and autism. And there are places where there are lots of gaps that need to be filled in that area. But some of the things that schools can do, there's interception curriculum that makes such a huge difference in the ability to function in the world. And schools, again, all over the world are using interception materials curriculum. There's a whole set of curriculum that's materials that have been developed in Australia that are used across Australia. There are a set of curriculum that has been developed by Kelly Mahler in the United States. It's used widely. That's something that can be done readily in schools and other settings. And also just whatever help with reading the social world is how I would describe the help that's often needed. And that can be provided in a range of ways, but just helping people to learn to read their social world so that they understand it better and aren't so mystified or don't feel so much like an alien in their experiences. And those are things that can be provided through in a school setting.
I'd like to add a little bit to that too. I think that one of the questions mentioned that schools weren't equipped, and again, as you said, there's a range of how well equipped some schools are and some staff members are. But the thing I wanted to add was for those who are identified properly and they're in special education, there's a requirement that for staff training and staff development if it's needed. And so if there is an identified gap, if you have a student who has some needs and staff members are not equipped to implement that child's IEP, his or her program, in this case, it'd be her program, then the schools are responsible. They're required to provide, training so that the staff get equipped. And so that's one point I wanted to make about that. With regards to what is specialized instruction, we think, very much that it needs to be individualized. So there's always an assessment component. So there's not, we wouldn't say just do this one thing, but more specifically, we say that you want to assess and then develop we call it a comprehensive plan, a program that develops, that is complete, that's not missing parts. And so when that program, if there's critical pieces that are missing, then that program won't work very well at all. And so we think that that's a good approach would be to make sure that we've done a proper assessment, that we're addressing the underlying autism. And that was something Ruth, Dr. Aspy, you mentioned earlier, was how critical it was that that you're working with individuals who understand the underlying autism. We also need to address that so we can build on strengths and address needs in a comprehensive way, which is a topic for another day.
You guys could probably do at least 2 or 3, lots of presentations. I was like, oh, that's a whole nother topic. Like, yes. So and then there's another question about employment. And somebody asked, do you have guidance for young women with ASD to help them identify what career would best meet their strengths and challenges? What careers do you find women with ASD are able to succeed in? And are most women with ASD able to work full time? So a lot of questions about employment.
Wow. I don't think that either of us are employment specialists. And honestly, I think the range of appropriate job placements is probably huge. But one of the things, to be honest, we do find that a lot of people on the spectrum, when it comes to employment, they need a different kind of downtime than their neurotypical peers. So I do know some for instance, people that have been on the speaking circuit with. We will talk to many people who are on the spectrum who do public speaking, and they will say, I had to take next week off of work, or I'm going to have to take several days off after this because I've had to be so social for so long. And so the social demands of a job, many girls and women can rise to those demands, but they may need a different kind of break between those kind of demands in order to be able to continue to cope with them. But I honestly think the range of appropriate employment placements is pretty big.
And yeah, and I can't speak to that either. But the other half of the question, when there was a question about full time versus part time, certainly you're going to see individual differences in that area. However, I would add that I think that that there is very often a need for accommodations and supports in the workplace setting, and that might increase one's ability to to work full time or longer.
Yes.
And in particular, some of the strategies that we've seen very successful, one of them is to have kind of a liaison, someone in the workplace who understands autism, who can kind of be that go-between and help that employee to interpret her social world, but also can help the colleagues to understand, her and her needs. And so I think that could be important. Sometimes sometimes direct job coaching is important again for educating the employer. And then and that's why I want to be mindful of that burnout, that autistic burnout. We know that for individuals on the spectrum, they find sometimes we like the term autistic stress, because there are things that for individuals on the spectrum find to be stressful that perhaps other people wouldn't find to be stressful. Maybe it's participating in a meeting, or having someone pop into your office all of a sudden. Those are things that in a workplace setting happen all the time, and we don't think twice about it. But for someone on the spectrum, that might be pretty overwhelming, or the noise level if we have cubicles or whatever it may be. And so there's kind of unique things that they may find to be stressful, and that can really lead to that kind of that burnout that we talked about, where they're going home exhausted and just completely drained. And so I think that those are some things about that could certainly extend one's ability to work throughout the day, would be to have the right kinds of supports. And sometimes that's like a liaison, and right kinds of breaks, as to your point, Dr. Aspy.
Great, thank you guys. I know it's almost time for us to be done, so I'll just ask like one or two questions more, if that's okay. Are you okay? Are you guys okay?
We're
Okay.
good.
All right. I know y'all said you could talk for 5 hours, but that would probably might not want to do that long. So another question we got was someone asking as an evaluator who is a speech language pathologist. And the question was, do girls still need to have repetitive behaviors like boys to receive an autism diagnosis?
Yes. Yes, they would need restrictive to qualify under the restrictive repetitive category, and we just need to be careful at looking at some aspects of that, in having in mind how the interests could look different in girls, that how they could be very intense interests that may interfere with their functioning, but still be typical interests in that they're things that other girls are also interested in. So yes, they would still need to fit in that category.
Right, but it doesn't have to be, to your point, it doesn't have to be like boys. It just has
Right.
to be, yeah, I mean, but like
Yeah.
that individual.
We
Yeah.
need better descriptors of what that looks like in women and girls.
Okay, good, thank you. Then we have a question. It says, regarding assessment tools that are designed for males more than females, when children and adults are born one gender but identify the other gender, how does it affect the assessment outcome? And I'm sure y'all see this a lot. I know we do. It's a great question.
It is such a good question. And I'll tell you what the disappointing answer is, that we spoke in binary terms all evening. And the reason we spoke in binary terms all evening is because that's the language the research speaks. And right now, we really don't know. We don't have the information about people who are transgender or who don't fit into nice binary categories. So I wish we could answer that, but we don't have much information. We do, however, encounter it clinically relatively frequently.
I do think that, as we've talked about, the characteristics are always there if you know what you're looking for. And so, and you know what I'm saying? And so, so regardless of of who you're evaluating, we should be able to understand and know what kinds of things to look for, to know what kinds of strategies would help us as an evaluator to to have the opportunities to observe or to ask the right kind of questions. That's one thing we see so often sometimes, is that we don't identify autism because we don't ask the right kinds of questions. And so regardless of that, whether we're looking at a transgender, et cetera, binary, non-binary, et cetera, we need to be asking the right kinds of questions and understand what we're looking at.
Great, thank you. Sorry, Dr. Aspy, so were you going to say something as well?
No, I'm good. I'm good.
Really good question.
It is a good question. And then somebody asked too that for the specialized, like the curriculums you mentioned in the first question, would you guys be able to provide us the links or or that person can email us and we'll send them? Is that something y'all could do?
Yes, we'll get you some links. Yes.
Okay, great. All right. So the person that asked if we can get the curriculum links, yes, we will get them. If you want to go ahead and email us. And then most of these questions are kind of overlapping now. We did get some great comments, so thank you. We had some comments that says this has been a wonderful presentation from an autistic adult who said they wish they had been diagnosed in elementary school, and their autism was missed because they were verbal and well spoken. And, and then that least actually, and this person said they had selective mutism. We got one more question about just about that. Somebody mentioned selective mutism, but someone else asked, is there a higher propensity to engage in stuttering as a speech disorder with women and girls?
I don't know.
I don't know that one either.
Okay.
The selective mutism is one we could talk about a little bit. But yeah, I'm not sure. Disfluencies, I don't know if there's differences in gender.
Good research.
Yeah, great
We
question.
need that research.
Good. All right, great. And I know you guys mentioned selective mutism with Greta Thunberg as well, and we definitely we see that and hear about that certainly.
Yes.
Great. Okay. Well, that kind of wraps it up, but we got a lot of great comments and thank you so much for that presentation. I also just wanted to mention that Dr. Grossman and Dr. Aspy gave us kind of an abridged version of their presentation. It's got the resources because there was a lot of great resources in this presentation tonight. So that's in our Facebook comments and it'll be on our website as well. And then I also, when I introduced them, forgot to mention that they are both on the Autism Society of America's panel of professionals. So we really appreciate that volunteer work and appreciate you guys for, spending your evening with us and everybody, because this has really been a very helpful and informative presentation. And I think that's it. I just want to go ahead and share my screen real quick. And then I'm going to cancel that. And I just want to show our next presentation coming up. Let's see if I can do this, because I missed it earlier. So our next presentation is actually, our next Seminars Across the Spectrum presentation is going to be Autism Acceptance, talking with your child about their diagnosis. And that's April 1st at 7:30 here on Facebook Live with Dr. Natalie Montfort. So we're excited about that. And then back to everybody here. So we're back to the studio. But so anyway, we thank you all for joining us. As I said, you'll see this is going to stay up on Facebook for quite a while. You can email Autism Society of Texas with questions. We also had questions. People are asking us, do we have lists of professionals? And yes, we do. So definitely email us for information and referrals help. We have support groups and social worker on staff, information and referral specialists. So we are happy to help. And anything else, we can contact Dr. Grossman and Dr. Aspy as well and get links and whatnot. So Dr. Aspy and Dr. Grossman, any final words of wisdom?
I don't think so. I think we may have exhausted everyone.
Thank you. Thank you again for this opportunity to present.
Yeah, absolutely. We really appreciate you guys. Thanks so much. I'm going to end this presentation on Facebook now. And thanks to everybody for joining us. All right.
Thank you.
Bye-bye.
Okay. I'm going to stop recording now too. Okay. And we're going to